Today, we're diving into one of modern medicine's unsung heroes. It's an invisible force that guarantees total stillness right when a surgeon needs it most. Really, it's the silent partner in just about every operating room. I mean, think about it. Surgeons are doing this incredibly precise work where even the tiniest muscle twitch could be a disaster. So, how on earth do they make sure the body stays perfectly, life-savingly calm? Oh, it all comes down to a special class of drugs. Their whole job is to temporarily disconnect the line of communication between your nerves and your muscles. And in that class, one drug has really become a giant of modern anesthesia. And here it is, rocuronium. Its job sounds simple, but it's absolutely profound. It creates a deep muscle relaxation that's essential for everything from placing a breathing tube to giving a surgeon the completely still field they need to work safely. So how does this stuff actually work at the microscopic level? To get that, we need to zoom way, way in, right to that tiny gap where a nerve signal tells a muscle fiber to move. The best way to picture this is with a simple lock and key. Your nerve endings release a chemical key called acetylcholine, or ACH for short. When that key slides into a special lock on your muscle cell, that's a receptor, the muscle fires. It's a simple, direct command. Key in, lock turns, muscle contracts. Okay, so here's where rocuronium hijacks the whole system. The rocuronium molecules come in, and they're shaped just right to fit into those same receptor locks. But, and this is the whole trick, they don't turn the key. They just sit there, basically jamming the lock. Now, the real key, acetylcholine, can't get in. The signal is blocked, and the result is complete muscle relaxation. And what's really interesting is that this paralysis doesn't just happen all at once. It follows this very predictable wave through the body. It starts with the small, quick muscles, like in your eyes. Then it moves to your limbs and your torso, and finally it relaxes the diaphragm and the muscles that control breathing. That sequence is absolutely critical for anesthesiologists to manage. All right, so that's the how. Now let's get practical and talk about the why and the when. Let's look at how rocuronium is actually used in the real world, inside the operating room. Turns out, rocuronium is a real workhorse. Its most common job is to relax the throat and vocal cords so an anesthesiologist can safely and smoothly place a breathing tube. But it's also vital for big surgeries, say in the abdomen or the chest, where any muscle tension would make the surgeon's job way harder, or even impossible. But you know, one of the biggest reasons it's so popular? Speed. Rocuronium works fast. With a standard dose, you get perfect conditions for intubation in just 60 to 90 seconds. In an emergency, that kind of speed can make all the difference. And after it kicks in so quickly, how long does it last? Well, a single dose will keep the muscles relaxed for about 30 to 40 minutes. This puts it in the intermediate acting category, long enough for a lot of common procedures, but not so long that it's unmanageable. Now, this isn't a one-size-fits-all drug. Anesthesiologists tweak the dose for the situation. For a normal, planned procedure, that standard dose is perfect. But in a high-stakes emergency, what's called a rapid sequence intubation, or RSI, they can almost double the dose to slam that onset time down to just about 60 seconds. Because when every single moment counts, that's what you need. Okay, but a drug this powerful, you know there's got to be a catch, right? There are definitely risks, so let's talk about safety, its biggest rival, and the incredible antidote that completely changed the game. Rocuronium's main rival on the block is another drug, succinylcholine. And there's a trade-off. Rocuronium is generally safer. It doesn't have as many side effects or trigger certain dangerous conditions. But it has one big disadvantage. It lasts longer. Succinylcholine wears off in just a few minutes, and that can be a huge plus in a crisis where maybe a doctor is struggling to secure the patient's airway. And this brings us to the number one, non-negotiable, absolute golden rule of using this drug. Because rocuronium paralyzes the diaphragm, the patient literally cannot breathe on their own. It is absolutely essential that a trained expert is right there managing their breathing with a ventilator. Any failure to do that is fatal. End of story. So you see the problem, right? What happens if there's an emergency and you need that paralysis to go away, like right now? For years, that longer duration was rocuronium's big weakness. And then a truly revolutionary solution came along. And that solution is a drug called Sugamidex. This thing isn't just an antidote. It's a total game changer. It works like a molecular sponge. Its molecules are shaped to perfectly surround and trap the rocuronium molecules, taking them out of commission almost instantly. the muscles can start working again, just like that. Sugamidex made rocuronium dramatically safer overnight. So when you put all the pieces together, you really see the whole picture, don't you? You've got a powerful drug that, thanks to this incredible antidote, went from being just a useful tool to a super safe and reliable cornerstone of modern medicine. Really, the magic here is the partnership. You take the speed and reliability of rocuronium, and you combine it with the rapid, dependable off switch of Sugamedics. What you get is a system that gives anesthesiologists an incredible amount of control and a massive safety net. All right, so let's boil it all down. What are the big takeaways? Rocuronium is a fast, stable, and super versatile muscle relaxant. Its safety was completely transformed by its specific reversal agent, Sugamedics. And, most importantly, you never, ever use it without an expert managing the patient's breathing, keeping them safe from start to finish. It's kind of mind-blowing when you think about it. For every heroic surgeon you see, there are all these silent partners, these invisible scientific marvels like rocuronium working in the background to make it all happen. It just makes you wonder, what other incredible science is out there, saving lives every day that we never even get to see?